There are many trans and non-binary people who come to know who they are before adulthood. That means some children and youth seek what's called gender-affirming care, types of care which can help a person explore their gender identity and be their authentic selves. But it can be difficult for youth and their families to know how to access gender-affirming care. One option in Nova Scotia is for gender-diverse people under 18 and their caregivers to self-refer to one of the child and youth mental health clinics around the province.
Every child and youth mental health clinic does have trained mental health clinicians, specifically trained to help support families of children and youth who identify in a different gender than that they were assigned at birth.
So those clinicians would be aware of local healthcare practitioners who are available in case the child or youth needs other referrals. But some communities may not have the right expertise, so some people may have to travel to Halifax for appointments. Meanwhile, family doctors, nurse practitioners, and pediatricians could refer their patient to the IWK in Halifax or to practitioners who are local to their area. And finally, family doctors who want to provide gender-affirming medical care but would like some guidance can seek physician-to-physician phone consultations from Dr. Mukashi. There are some virtual care options as well, but certain assessments and appointments can only be done in person. As for what medical care is available to trans and non-binary children and youth, it really depends on their age and other circumstances.
Medical options for children and youth are carefully considered. Not all children and youth who identify in a different gender go on to need the medical options.
There are puberty blockers, which temporarily stop the progression of puberty and provide the child with more time to seek supports and to explore their goals and gender identity, for example, through clothing. The treatment is reversible, with puberty beginning typically within 3 to 6 months after stopping treatment. And international guidelines say that puberty blocking treatment can help reduce the distress that comes with starting physical changes. These blockers are available to adolescents who have reached an early stage of puberty. But there's no standard age when this option becomes available because the beginning of puberty is different from person to person. Hormone therapy is a partially reversible type of care that's also available. Estrogen or testosterone can be prescribed to help somebody develop physical characteristics that are aligned with their gender identity. Again, the timing of when a person could be considered for hormone therapy depends on their needs, but generally it could be around the age of 14. And trans and non-binary youth don't receive gender-affirming care overnight. There's a comprehensive assessment process that can involve taking their history, figuring out supports, and ensuring their gender identity is persistent. It also means involving parents or caregivers in the process and determining if the child or youth has capacity to consent. If they don't, physicians would defer to the parents' or caregiver's decision. This process of informed consent, where physicians ensure a person understands the risks and benefits of receiving or not receiving a treatment, is not unique to gender-affirming care.
There's no age of consent in Canada for medical decision making, and we use that consideration of, is this a mature minor, do they have capacity for consent in many aspects of medicine, not just in this area.
As an example, a youth who has only been identifying as transgender for a short time may need to wait a few years to access hormone therapy. And hormone and puberty blocking treatments aren't new and have been used in other situations. For example, the blockers are commonly used with very young children who develop puberty too early. Meanwhile, for gender-affirming surgery, the province's policy states that an individual must be 18 years or older at the time of the procedure, among other requirements. There are limited types of surgeries available for teenagers 16 years or older, but this requires an exemption application. Gender-affirming care also doesn't have to be medical. I spoke with IWK child and adolescent psychiatrist Sue Zink, who says care can begin with helping a youth and their family have their needs met. And so there's no age limit, for example, to be referred to the gender care team at the IWK for resources and support. Ultimately, Dr. Zink says medical evidence shows gender-affirming care makes a positive difference for trans and non-binary youth and children. She says, children who have accessed puberty blockers can show less disruptive behavior and distress, and can even have better ability to focus in school. Meanwhile, for older teenagers and adolescents, gender-affirming care can reduce gender dysphoria and improve mental health, which can then have positive knock-on effects, like improved self-esteem. I asked the Canadian Pediatric Society about their perspective on all this. In a statement, they said access to evidence-based healthcare is a human right, and that gender-affirming care is the standard of care for trans and gender-diverse youth. Andrew Lamb, CBC News, Halifax.